Miss Mullen. My name's Caitlin. I'm a student nurse at St. Francis. I'm going to go ahead and give your baby an assessment really fast, if that's okay. All right, I'm just going to go ahead and first check your name band, and if you could repeat your name and date of birth. And then I'm going to go ahead and verify that with the bracelet on the baby. All right, perfect. All right, so first looking at the baby, I'm going to go ahead and do some vitals. So I would first do their temperature, and a normal temperature is 97.7 and 99.5. Then I'm going to go ahead and for heart rate, I would listen to the heart for a minute. And a normal heart rate would be 110 to 160. So I would listen for a minute. Then for respirations, I would also use my stethoscope and listen, and normal respirations are 30 to 60. So I would listen to those. And then while I'm there, I'm going to go ahead and listen to the heart sounds in all of the 5 quadrants. And then I'm also going to listen to bilateral breath sounds. And I'm going to go ahead and flip the baby over and listen to the breath sounds on the back. So I'd flip them over, support their head, and I would go ahead and lift their shirt up, and then I would listen to the bilateral breath sounds on the back. All right, and then first I'm going to go ahead and look at their head. Just initially looking at it, I don't see any bruising, any scratching. As I'm feeling their head, I'm feeling for the molding, which is natural right after birth. I'm also feeling the front and the back fontanelles. I'm feeling for suture lines. I don't feel any that overlap one or the other. Then I'm looking for 2 different things that can be on the scalp. First, there's cephalohematoma, which would be a bump on a side of the head after birth, and that would be filled with blood. Or they could have capsuccedaemion, which would be all over the scalp, and it would be filled with fluid versus blood, which I'm not seeing on this baby. Then looking at the eyes, I'm seeing that they are symmetrical. They're a third of the face. I'm not seeing any discharge. The conjunctiva is good. Then I'm also looking, I don't see any epicanthial folds. Looking at the ears to the eyes, I can see that it's equal. I can draw a line from the top of the ear to the eye. Go ahead and folding the ear for recoil. It's a quick recoil. Then looking at the nose, I would go ahead and test patency of the nose. So I would plug one of the nostrils, and I would be able to feel them breathing on the other side, and I would do that for both sides. Then for the mouth, I'm going to go ahead and put some gloves on. One of the things with the mouth that I'd be looking for is rooting. So I would go ahead and place my finger next to the baby's mouth and see if they would go ahead and look for my finger. So I would do that, and hopefully they would turn and try and get my finger. Then I would go ahead and put my finger in their mouth, and I would test the sucking reflex. I can feel the hard and soft palate and feel that they're connected. And then I would go ahead and take my gloves off, and I would exchange them for a new pair, and I would throw these out. Then looking at the neck, I can see that there's no masses palpable, and then I would go ahead and try and test the range of motion. So I could go ahead and just manually test their neck range of motion. I could put something on the side and see if they turn their head. I could lift it up and down and just test the range of motion on their neck. Then feeling their clavicles, I can tell that they're not broken. I can see that there's no swelling, no redness, nothing with that. Then I'm gonna go ahead and look at their stomach. So first I would listen to the bowel sounds in all 4 quadrants. I would see whether they're hypo, hyper, or just active. So I would listen in all 4 quadrants. You wanna make sure that you listen before you palpate. Then I would go ahead and palpate all 4 regions, feeling for masses or any abnormalities, which I don't see any here. Then I would go ahead and look at the umbilical cord, where it was. So this baby would still have it attached. It's drying, it's in the stages of drying. I don't see any discharge or any extreme redness, so that's good there. Then I'm gonna go ahead and look at their diaper. Here would be a good chance where I could ask the mom if they hadn't soiled their diaper when their last void was, bowel movements, everything that's been going on with that. And then I can also ask when they're due for another feeding. So if the diaper was soiled, I would definitely make sure to change it. So this is male, so for the male genitalia, I want to look and see if there's any rugae on the baby, which there's not for this one. There's the urethral humides is center on the head of the penis. The testes are slightly distended. If it was a female, I would mention normal would be the labia majora would be above the minora. And then if a mom gets concerned about any like white discharge on the female, just go ahead and tell her that that's normal, and you can just wipe it away at this point. I do have the baby uncovered. I'm gonna go ahead and examine skin. So I don't see any bruising or scratches. I'm also gonna look at the backside for skin at this point as well. I'm not seeing any signs of jaundice, which you can see jaundice in the head, the chest, the stomach, the legs, and then in the conjunctiva of the eyes. So I'm not seeing any jaundice on the skin. As I looked on the back, I saw that the spine had a nice curvature to it. It was no abnormalities there, no back dimple. I didn't see any tufts of hair. Also, while looking at the abdomen, still it's nice and round, so that's good for the abdomen. And then at this point, you can look for any signs of respiratory distress. So there's 5 different signs. There's nasal flaring, there's grunting, there's retraction, there would be the seesaw breathing, and then if they have any apnea, that's greater than 20 seconds, which I do not see here. Also, at this point, I'm gonna go ahead and test their arm recoil. So I would go ahead and flex their arm up to their chest and lower it down, and then if the baby would bring it back up, that would be a good arm recoil. I would wanna make sure and do it on both of the arms. Good. And then while looking at the hands, I can go ahead and see that there's 2 of the creases, which is good. There are 5 fingers. And then looking at the feet, I can see that there are 5 toes on each foot. And if I test the Babinski's test, I would expect the baby to curl with their toe or flex with their toes. I can also see creases on the bottom of the baby's feet, so that is good. I'm gonna go ahead and leave the baby unopened, test for the Marlow reflex. So for this baby, I'm gonna go ahead and clap. And then if they sprawled their arms out and legs, then that would be a positive for that. Also for the diaper, you wanna make sure that you don another pair of gloves. And then, like I said before, I can ask the mom about voids. I can ask about when their next feeding is, and just make sure that there aren't any needs that the mom or the baby needs.